going to be doing some questions and answers with Dr. Rashid Chattani, who is a public health physician and infectious disease epidemiologist. So welcome, Dr. Chattani. We're so grateful to have you here with us today to talk to us about coronavirus, COVID-19, and some of the implications that people need to know about. Before we get started with the questions, can you tell us a little bit about your background so folks know what your particular area of interest is?
So first of all, thank you very much for having me on your show. Welcome to all the audience. We are here today to specifically talk about coronavirus and essentially understand what the disease is doing and understand how we can protect ourselves from that disease. I am a physician by training, and then at Hopkins I was trained in various disciplines, including public health, hospital epidemiology, where I learned how to do outbreak investigations, vaccine sciences, and biomedical informatics. I developed the first early detection system for bioterrorism for the United States, which is implemented across the DoD and at CDC, they've modified it quite a bit, but it's there. I have spent the majority of my life working at the U.S. Department of Defense, where I held various positions, including being the chief scientist for the U.S. Chemical Biological Defense Program. That means that all the vaccine, drugs, and diagnostic devices that were being built or put together for our warfighters, I was involved in that essentially, and some of the products that we developed over there were then transitioned over to the civilian world, including during the influenza pandemic. We had a diagnostic device that would help people get identified very quickly if they had influenza across the world, and was a very quick, fast device. And then I was involved in the program that started the Ebola vaccine and Ebola drug program that ultimately helped, fortunately, a lot of people in Africa when we had the Ebola outbreak, etc. Do a lot of things. One of the critical things that we are sitting in Virginia right now. I am working on COVID-19, looking at the epidemiology because that's what my interest is. I've been working on coronaviruses, influenza, and lots of other viral diseases for a very long time. But with coronavirus from 2003, when the first SARS outbreak happened. And now one of the critical things that we are trying to do at our facility over here in Virginia at CareLife is that we are trying to figure out a way how we can quickly identify people who have the disease. Fortunately, Virginia just passed a law that now healthcare facilities can do the testing, and we are in the process of acquiring a test which will be able to identify and screen you in about anywhere between 10 to 15 minutes, and then you would know if you have the disease or not. It's still preliminary, but I believe that as citizens, we all need to work together. The government is trying their very, very best to get things resolved. But I think with the national crisis that we have right now, we really need to put on the lab coats, essentially.
Exactly. Well, one of the things that we did was we talked with a lot of our readers and our various folks involved here at Health Central and got a number of common questions that just keep coming up from people over and over again. So I'd love to see if you can help illuminate the answers to these for some of us, because there's a lot of people with a lot of questions. And I'm also going to invite our viewers out on Facebook Live today to share your questions in the comments area. If you have any particular questions that you want us to get to with Dr. Chattani, we would welcome your thoughts or your questions. But I think the first question that I'm hearing from a lot of people, Dr. Chattani, is what exactly does COVID-19 do when it gets into the body? And why are we seeing such a disparity in symptoms from people who describe it as being not much different than a cold to people who are on oxygen and ventilators in the intensive care unit?
A very good question and a very valid question from the people that have asked that. One of the critical things is to understand one thing before we start a discussion on coronavirus is that every year influenza hits us every single year. So let's talk a little bit about that so that we can understand and have a perspective of what's going on. So influenza hits us every single year. And every single year, between 20 to 65,000 people die of influenza. We have a vaccine for influenza. We have an antiviral. We have multiple antivirals for influenza and multiple vaccines for influenza. So yes, that does happen. And what has happened over the years is that we are so used to it that we don't even think about it too much. But we have to. Now, this disease, as it came out as a new disease, which we did not know about. We knew about it in 2003, and again in 2012, it came back as a totally different strain, which is called Middle Eastern Respiratory Syndrome, MERS coronavirus. And so we have a lot of lessons that we learned from that. So the first thing was that coronavirus came as SARS. In 2003, it caused a lot of anguish. One individual infected a lot of people. We were able to track that down, and the mortality rate was pretty significant. Then we had MERS that appeared, which was not the same strain as the SARS virus, which is also a coronavirus. There are God knows how many types of coronaviruses out there. We know that right now 3 of them have infected humans, but there are more that have actually infected humans that we have identified. Research has identified, but there might be about 200 types of coronaviruses, or maybe more, or maybe less. Who knows? Because we really don't know the landscape completely. But what we learned in 2012 was that MERS came. The mortality rate on MERS is extremely, extremely high. It's like almost, close to 30-40%, so it's huge. But what we also realized was that the disease kind of stayed with us over the course of the year, but during winter season, it spiked, and we saw more cases and more deaths.
Yeah.
So we had that. We also had developed, people had started developing, some sort of an antiviral or some sort of a vaccine for MERS. So that was already part of that. Now, the question that you asked was, what does it really do when it gets into the human body, right? So where does it come? So what we do is we inhale it, right, through particles. We also, when people cough or something like that, and if you're close to them, those particles kind of stay in the air for a little bit, and then you can inhale it and get it. Also, when somebody coughs, the particles can actually drop on hard surfaces, like a table, a glass table, or a wood table, or a doorknob, or whatever, and you can touch them. But over there, it lasts for a very long time, anywhere between 5 to 9 days, 7 days, whatever the numbers are. We still are not 100% clear on that. We're still doing studies on that. So that is so now what happens is that we either somebody coughs on us, somebody sneezes on us, we get it in the air, we inhale it, or we pick it up from the door or someplace else on the table and rub our face a little bit. That's why everybody's saying, don't touch your face, for God's sake.
Right.
So we get it because eyes are open, right? Nose is right there, and mouth is right here. So you can kind of transmit everything very easily. Now, we've also found out that the virus now has some airborne qualities. And that means that it can float in the air for a long period of time, and it can go from one room to another room, or kind of transport. So that is a pretty scary scenario.
Yeah, very.
But I'm not here to scare you. Now, coming to the question, goes inside, goes back, into your throat. Then from there into your mouth or the nasal cavities, and from there it goes into your throat, and from there, guess where it's going to go? It's going to go into your lungs, right? So what it does is, now everybody has seen the coronavirus picture, right? It's a round ball with things that look like flowers that are coming out of it, right? Have you seen that picture?
Oh yeah, the one with the red, the little red flower type things all around, like a
yes.
Absolutely.
Yes, those are the proteins. Okay, that is the protein. Now this is an RNA virus, and RNA viruses have a very fine encapsulated layer on top of it to protect them. Right? It's not a thick layer, which is good. That's why alcohol is good for it. Now, rubbing surfaces, where cleaning them up and cleaning your hands with 60% alcohol-based solutions. But that little flower type thing that everybody's looking at, that's the protein, right? And then there are proteins inside the human body. Okay, the epithelial. So it goes and lodges itself on the epithelial cell. So the protein has a receptor, what we call, right? And it attaches to the host cell receptor. So it will come and kind of go like attach it to the receptor in the epithelial cell that is ours. And that's where the process starts. And then the first initial symptoms are upper respiratory tract infection, because you've got things going on over here, and they've not really gone down to your lungs. So now once it has gone down to your lungs, then all those other symptoms appear. So initially, so upper respiratory tract infection, like a runny nose, mouth, having something in the larynx. Yeah, exactly. So those are the things that are like influenza, right? So it can. So the disease can be masked, and essentially people might think that you have influenza, but you might have coronavirus.
Sure.
You have dry cough, then you develop dry cough because it's going down now. Then you have shortness of breath. Shortness of breath is something that if I am talking to you right now and I'm okay, the way that I'm talking, this is my normal way of speaking, and all of a sudden I'm walking a little bit, or all of a sudden sitting around and I go, I'm short of breath. And that shortness of breath is critical to appreciate in this disease. Fever is another one. Some people have gotten headaches. Some people have reported muscle aches and pains. One of the things that a lot of people have said, and that goes along with everything, that I feel tired. I feel tired. So all of those are flu-like symptoms, right?
Yes.
This is what you get every single year with flu. So a lot of people might think that they have flu, and they might not. And this is how it is. So the virus goes inside, lodges itself on the, on our epithelial cell, the mucosa and the epithelial cell, and then it attaches itself. Then it migrates to the lungs, and then it goes into the bronchi, the tree that we have in the lungs, where the ducts are and all that, where the oxygen is being cleaned. It lodges itself over there, and then it can multiply, right?
Okay.
Now, all of the audience, whether they're physicians, whether scientists or not, they have kids. Most of them. If they don't, they have gone to school over here, and they've always had to work on a petri dish where you grow something, right? And you put a little piece of, you put a little bit of bacteria in there or virus in there, and a couple of days, under ideal conditions, it will grow. And that's exactly what happens over here too. So it multiplies. When it multiplies, then the body, because it's never seen it before, right? I mean, even before that, as soon as the virus enters the body. Now, most of you have been, have gotten a splinter, right? And when you get a little tiny, minuscule little splinter, or even a hair that is stuck in your skin, right? It hurts. The body recognizes it, that this is a foreign body. So when a virus or a bacteria enters a body that the body has seen in the past, it knows how to engage with that virus. It knows what it needs to do to destabilize that virus or kill that virus or bacteria.
Right.
But if it's never seen that before,
then it doesn't know what to do.
It doesn't know what to do. And there's confusion that's going on inside. So that is the cascade that happens. And sometimes there's this cascade that happens, which is called the cytokine cascade. In some patients who get really, really sick, are admitted to intensive care units, will have multiple, organ failures and things like that. And lungs are going to not work. And that's why they need ventilators and things like that. So it is again, one more thing to understand, that we are still learning a lot about this disease, every day. And there are questions that probably will come through. And I know that there is one particular question that people are going to ask. I'm going to wait for it because every day, use this, don't use this. This is good for you. This is not good for you.
Right.
Because we are in the learning phase right now.
Exactly.
I hope that addresses that question.
Absolutely. Very helpful. And actually, kind of as a follow-on to that, we've got question. Gabriel, one of our viewers, wants to know what the incubation period is. And also a related question, can we be carrying the disease or infected or even infectious to others without showing symptoms ourselves?
Absolutely. So first of all, the incubation period is anywhere between 1 to 14 days. And 5 days is the critical day that most people have shown symptoms. So it is, and in some cases, the incubation period has been much, much, much longer. So we are still learning about the disease, but most of the people at day 5 elicit symptoms, but there are people who can have the symptoms on day 14 or some other day. Critical thing, whomever asked that question, the second question, I think it's very important, extremely important, and I hope there are some young people online that are listening to it, because when I was a teenager, I always felt that I was invincible. I could go and ride a bike without wearing a helmet,
Sure.
right? And
We all do.
I could just, we all do, right?
Right.
We all do. So it's mainly for that particular audience, as well as all the other audiences, all the other individuals that are listening to it. So almost everybody can get the disease, whether you are a newborn or you're 80 years old. So everybody can get the disease. 50% of the patients who get the disease will have absolutely no symptoms whatsoever. They'll be walking around, healthy, laughing, running around. Nothing is going to happen to them. It's a very mild, super mild form of disease. But remember, all those people have the disease, and they potentially are now transmitting it if they are going out and coughing, if they have a small cough, or whatever they're doing, they are transmitting it. By the way, there's another route that potentially is, there's a fecal route also, that there's viral shedding in the feces also. So that's another particular area of concern now. So now even if you're healthy, right? Absolutely healthy, you can transmit the disease. So a child, feeling great, and going, listen, like my kids were saying, I live in Great Falls, Virginia. There's we're going to the park. I said, no, you can't go to the park. And they said, why? I said, then essentially what you're doing is you're getting it. If you don't have the disease, you potentially can get the disease. There's a very small chance that you will have any symptoms or anything that's going to happen to you, but you're going to bring it back home. That's why we have school closures, for God's sake. That's why we are saying all the businesses are locked down. Right. That's the reason, because what's going to happen is then you're going to bring back the disease to us. And I said 50% will not have any symptoms. 80% of all the people who get the disease, 80% of all will not require any type of medical intervention.
So they can just write it out at home with tea and ibuprofen, not ibuprofen, Tylenol. Actually, that's a good question. What about the ibuprofen Tylenol controversy?
Oh, yes. I knew that somebody was going to say that, so I didn't say it. I wanted somebody to ask me that question. So yes, ibuprofen was being, was said that it's not good for you. You don't use it. Medical literature has just come out, and now it's saying that ibuprofen is fine. There's nothing. There's no serious contraindication for using ibuprofen, but it's recommended that you use Tylenol or something like that, acetaminophen. So that is the only recommendation. But that huge red flag that was on ibuprofen was just lifted, I think, yesterday and today, in that time frame, just in the last 12 hours.
Okay, that's good. That's good news to know then for those people who like to use ibuprofen over Tylenol or acetaminophen. So.
Absolutely. But, it's recommended still to use Tylenol till we get some more concrete data, right?
Sure.
And just go with use common sense. That's the most important thing now, right? So if you can get away with Tylenol, get away with Tylenol. But I don't think there's a huge problem. Now, initially, there were a lot of people who have heart disease that are, and other hypertension, things like that. And, we're saying, oh my God, this virus specifically, if you have the disease, ACE inhibitors, you should avoid them, right? And everybody's talking about that. There are so many articles out there about it. Recent studies have just shown that, because the virus attacks ACE inhibitor 2, and it goes to a different location, and there is ACE inhibitor 1 that is affected specifically when you're taking the medication, and that is the area that it touches. So right now, the new recommendation that has just come out is that if somebody's on those medications, you don't really have to take them off, but don't put any new patients on that medication till more research and data comes
out. Okay, that's a good point.
Some relief, right? Some relief in some regard. So now I've said that 80%, we still have not gone 100%, right? You want me to finish the 100%?
Yes, please do. Please do.
Okay, so 80%, we said, will not go to a doctor. 20% might have to go to the physician or a healthcare facility or an emergency room center, right? Out of that 20%, out of the entire 100%, the data currently suggests, again, disclaimer, data currently suggests that only 5% of them will need hospitalization. Still, that's a huge number of people when you think about it, right? And then only 1% of all the people who get the disease will require intensive care unit, and they'll be critically sick. And majority of them, when they go to the intensive care unit, will require a ventilator. That's why, when you hear all the legislators talking about things, they're talking ventilators. But we also need a lot of other supplies. But that is that's a shortage. And why is that a shortage? So our hospitals are built today to keep almost 80% occupancy, so that there's not a financial loss. So we don't have a huge surge capacity in the hospitals. So we keep things just in time. That is one of the things that is good for the economy. And under normal condition. Now, influenza had already been taken into that equation, or you added that. Okay, during winter time, you need more beds, more intensive care beds, more ventilators. We have that covered. Now, most of the hospitals don't. They have ventilators during the rest of the year, but during the winter they rent ventilators from vendors, because they don't need to keep, because that's a huge expense, maintenance and all that. So they don't want to keep it. I'm not by any means, I'm not saying that this is not the right way to do, healthcare, but it is. But what happened was that we were thrown, a wrench was thrown into that equation, right? And everything just went like, oh my God, now what? Now, we were prepared for influenza. And this season has not been a great season for people who get influenza, although we have a vaccine. And we'll talk about the efficacy and how many, what percent of, even if we have a vaccine, how does it work, right? So now we are left with that we don't have enough intensive care unit beds. We don't have enough ventilators. So that is the struggle right now. And that's what a lot of people are doing. And I think we are quite a bit behind the 8 ball over here in terms of what we should have done. And I've been saying that for the last 2 months in terms of preparation and preparedness, because one of the lessons that you go to my LinkedIn page, you can see that you can track it down, or Facebook page, you can track what I've been seeing, because one of the things that I have learned over the course of many years, over the course of more than 20 years now, and I've worked in the United States, I've worked in South America, I've worked in Asia, I've worked in Africa. There are very few countries that I'm fortunate that I visit all those countries and work with a lot of different people over there. One of the things that I've always appreciated is that viruses do not observe borders.
True. We're learning that all of us collectively, I think, over the last month or two.
Absolutely. And if anybody has any kind of doubt in that, right now there are so many interactive maps of United States. Just go to them, take a look, and you will see that, states around New York State, where they have the highest number of cases right now, those are the first states that are getting affected. You take a look at Washington State and you look at the map and you'll see, other states of getting affected. So basically what you're seeing is, even with the lockdown, even with all the precautions, the virus is traveling fast.
It's moving,
It's moving. And when I said that, don't go out, because to my kids, is because, what is the advantage of doing that? Let's for a second talk about that.
Sure.
So if, for example, you don't go out, right? And you have, you have family, you don't go out. If you go out and if you acquire the disease, you're asymptomatic, you still go to the mall, you still go to a park or something like that, and then you can. So there's a potential that you can infect 2.5 people from yourself. Right?
Is that the average of infection? This about 2.5. Okay.
2.5. So now you've infected 2.5 people. Now those 2.5 people, if they are not quarantining themselves, because they don't know that they got the disease, right? And they're like you, feeling invincible. They're out.
Good, right?
They're going to go out, and each individual is going to infect 2.5 people, and then it just spreads wild from there.
And with no vaccine and no immunity, no one is going to be able to fight it off. Correct?
No immunity. Yes, absolutely right. Right now, we are not immune to this thing. Right now, we are absolutely. So the term that we use in epidemiology is a virgin population.
Virgin population. Okay. Well, I'm getting a couple questions from folks out in the audience who want to know if their pneumonia vaccines or their flu vaccines confer any sort of protection or immunity against COVID. And I'm wondering if you can give us some thoughts on that.
So that's a question that a lot of people have asked. So,
Yeah.
And one of the things that, if pneumonia vaccine, the pneumococcal vaccine, was a vaccine that gave you protection against pneumococcal bacteria, then then we would not need influenza vaccine, would we?
Right.
If right?
Yes,
If
exactly.
measles, so we have measles, mumps, and rubella. We get vaccinated for all three of them in a separate way, right? Three different vaccines. Hepatitis B, vaccine. So if one vaccine was good enough to cover other diseases, no. Yes, it is true that you have the same kind of symptomatology. You have the same kind of initial presentation of a disease in COVID-19, versus influenza or maybe pneumococcal pneumonia. But no, it's not going to help you, because each family of virus has a different configuration, and that configuration is critical for to develop a weapon. Literally, what we are doing is developing a weapon against it, right? Okay. And it has to be a specific weapon that affects it, not anything else. Now, the other thing that everybody needs to understand and appreciate, okay, and this is not a very good thing for people, and I just want to make sure that they know that. So it will take, the vaccine takes a long time to make. It's not a joke. And we can talk about that later if you want to, but the critical thing to understand is that vaccines are never 100% efficacious. That means that if you get the vaccine, some people are still going to get the disease. We've had flu vaccines that sometimes have shown 60% efficacy. That means that 6 out of 10 people who get the disease, who are exposed to the disease, will not get the disease. 4 will still get it who got the flu shot. So you can, it's not like you're putting a lock on your body by getting the vaccine. You are decreasing your probability and the chance of getting a disease. The other thing the vaccine does is that if you get the disease, and there's some studies that clearly demonstrated that if you get the vaccine, the intensity of the disease is not the same.
Okay. Now, we're having a lot of folks that want to know more about the concept of building immunity. If you are one of those people who has a very mild case of COVID and you recover, you go through it, it's not a big deal for you, you recover. Are you immune? And how long does it take to develop that immunity? Or can you catch it again? Especially if you've had a milder case, does that mean you're going to be more likely to be able to be infected again?
So, my God, what a brilliant question, okay, and what a important question that is. Now, one of the things that we have to appreciate, as I said at the very beginning, that we are still learning a lot about this vaccine. We have a case study in South Korea. We have a case study in China. And people have gotten the disease over there, and they have, they're on a downward trend right now in terms of their epidemic outbreak. And what we can do is I'm hoping that researchers, and I know that researchers are taking a look at it because they already know who was the person who got the disease. And then, once they had the disease, they recovered. Because the ones who don't have the disease, we don't know anything about, right? Who don't illustrate any kind of symptoms. But the ones that were hospitalized, we know that. And we have to study in a longitudinal way for a period of time to kind of understand and appreciate if that individual will get the disease again or not. We don't know too much about it at this point. Okay. So I would still say use common sense, use precautions, because we don't know too much about it. And one of the critical things to appreciate is that, one country that we always look at when we develop the kind of vaccine that we are developing for influenza, for example, for our nation, is Australia. And why do we look at Australia? We look at Australia because it's on the other side of the equator, right? And when we have winter over here, it's summer over there. And the concept of influenza and the way that we've looked at influenza and various viruses is that they propagate much more during winter time than during summer time, right? So we look at the strains that are circulating in Australia, and then we look at the strain that was circulating in the United States last year, and based on that, we put 2 influenza A strains in the vaccine and 1 influenza B strain in the vaccine based upon these calculations.
Okay.
And that's the concoction that you have for the flu vaccine. But what we've noticed with coronavirus is that it's spreading in Australia. It has, it actually, the 2 people, one of my favorite actors in the whole world, Tom Hanks, got infected with coronavirus, and his wife, whom I like as much, but I do like Tom Hanks more. But he got infected, right? And he was in Australia, and there's community transmission in Australia where it is the middle of summer.
Right. So that's a question that actually came up, is people have been asking, do we think that once the weather warms up here in the Northern Hemisphere, this is going to disappear? And it sounds like maybe from this, the experience that you're talking about of community spread down in Australia, that we may not see quite a seasonal pattern like we do with regular influenza with the COVID.
So I would say that we will see a seasonal pattern based upon what we are seeing right now. But there is going to be some sustained activity of COVID-19 across the year. That's what it looks like. Again, we still are, pretty, we are in the infancy of learning about this disease. And as I wrote someplace, in God, I trust, but give me data to prove science. So, in science, I have to get the data. And the data right now shows that if the disease is spreading in Australia, that there is something unusual, different about this virus. And, we still have to look at various strains. We still don't know too much about it. If the strain, when it transmitted from China and moved from China to Europe, and it had moved to the United States before that, because viruses, guess what? Like human beings, viruses want to live. They don't want to die. And in terms of survivability, what they want to do is they want to mutate like the computer viruses do.
Right.
And they kind of change the configuration through external pressures so that they can live. So the strains change. Influenza changes, drifts, what we call, every single year. If there's a shift like we saw in H5N1 pandemic recently, all of us have seen it. That was a shift. Now, H1N1, we had not seen for many years since the Spanish flu. Spanish flu killed a lot of people. H1N1 was there. Then it disappeared, completely disappeared, not appeared at all. Then, boom, it came back and caused a lot of disease. So that was a shift.
Do we think that at some point, once there is a vaccine or maybe some other mitigation and other types of approaches to control this, are we going to see a point in the not too distant future where we're going to be looking at this like it's the flu, where we get vaccines and we have some seasonal transmission, but it's going to be manageable and under control? Or are we looking at, long periods of rolling lockdowns and massive disruption? I mean, give us a little sense of where we may be going with this in the near future and, a little bit down the road here.
So what I always say is fear leads to panic, and panic leads to irrational behavior. And that's what we don't want. We want to, again, as I said, we still are collecting data. We are in infancy of learning about this disease, but we know one thing for sure. One thing is definite in my mind, and I believe in that in the next 12 to 18 months, we are going to have a vaccine available against this particular virus. No question about it. In the next at least 3 months or maybe more, 3 to 6 months, let's call it that way, we will have an antiviral out there. There's so many studies that are going on, so many new trials that are happening for therapeutics or drugs and vaccines. We will get there. I think we have to have faith in that system, and we've got to, we just have to believe in that, and I think it's going to happen. It's not because, and again, there is data, that's why I'm saying from science perspective, there is definite data that I'm saying that. So is it going to last for, yeah. And you know, what's going to happen is that it will be part of our equation now in terms of, what are the resources that we will be needing, what is critical, and how things are going to move forward. And I remember something, and it's not such a distant, past, and I'm sure all of the audience was part of it. You all remember 9/11, right? After 9/11, we were all these TSA requirements, and everybody was yelling and screaming and going, God, why am I being checked? What's going on? These lines. Guess what? Today, everybody is kind of used to it. I'm not kidding. Seriously, everybody's used to it.
Yeah.
We all know exactly what we have in our pockets.
We all know laptops and unloading
exactly,
everything.
Right?
Yeah, it's normal.
Exactly. So human beings, we're not, physically evolving. Somebody asked me this question recently. So, in terms of evolution, are human beings evolving? Physically we're not evolving. We've not developed another finger or a thumb or a ear or an eye, right? So so we are the same. But what we are best at is kind of changing our behaviors, modifying everything around everything so that we are trying to make it work, and we are really good at that. And if you think about it, if anybody who did not think about it up till now, think about how life was. When I was a child, I remember walking all the way to the plane at the airport and seeing my dad took me to see a plane, right? We can't do that anymore.
Exactly.
But the thing is, we've adapted to it. So we're very, very, very good in adapting things that need to be done, so that everybody works and everybody is moving forward in life. And that is the only way out of this thing. Because if you start, going crazy, nothing's going to happen.
Absolutely.
Think positive, and we can make it happen. I think this is something that will pass too, like a lot of other things have happened on this earth to human beings.
Well, let's talk a little bit about just some common sense things that people need to know, because you were mentioning that the droplets can land on hard surfaces, it can land on clothing, and they can stay infectious for certain periods of time. We know up to maybe 9 days at least on hard surfaces. What about on fabric or clothing? Do we need to be concerned about, a week or 9 days on those, or is it more likely that it's not infectious after a shorter time frame on that?
Very, very, very valid and a good question. And so there are multiple things to look at right now. We know that it can stay on hard surfaces for a long time.
Right.
And most of the audience probably looked at videos or saw it on news that they were burning currency in China and Korea. So there was a paper issue. There was a fear that it could be transported on hard boxes or envelopes from different countries, mail and all that. So those are valid questions. It can survive. And the other thing, I questioned myself just yesterday as this was going on, because I'm now, what I do is when I open the door, right, the door handle, I'm trying not to use my naked hand. I try to use my sleeve or something and go up like this and open the door so that I'm not gripping it, or my jacket, and using that to open the door. A question that still has not been answered. It potentially could survive on clothing, like it survives on other things. We don't know the exact answer as yet.
Okay.
I'm pretty confident now that there's a possibility that it can survive on paper or stuff like that. But we don't know for how long. Because it's a live thing and it can live, if it can live on different surfaces. So today I was asked, I can't name it, but there are people who are looking into that. And so I worked after 9/11 not 9/11, the anthrax outbreak in the postal offices and the Capitol Hill.
Sure.
In terms of how. So in those days, what we started doing was we started irradiating the mail.
Mm-hmm.
Is that something that is going to happen? Maybe, I'm not sure, unless and until the research comes out and conclusively tells us that it is on those envelopes and it can survive there. We don't know as yet, but stay tuned. I can guarantee you in 2 days you will know, because people are working on it.
And in the meantime, it sounds like rather than using our sleeves to open doors, maybe grab a paper towel and use that and then dispose of it and wash your hands afterwards, right?
Absolutely. But washing the hands, and this goes back to, God knows, 19. My God, I was young then. But the first paper, I'm not kidding. The first paper that I got published is called Hand Washing.
Really? Okay.
Yeah.
Well, tell us about the benefits of hand washing and whether we're doing it right when we think we're, grabbing our soap and washing. Are people actually getting the benefit of it, or are we rushing through it too quickly or not doing it correctly?
So, hand washing is, so that was when I was doing my fellowship in hospital epidemiology at Johns Hopkins Hospital. And my job was to kind of work and make sure that people were keeping infection control practices in place. And hand washing was the number one thing. So people could find me standing in the bathroom, the common big bathrooms, and having and observing surgeons walk in and walk out.
Okay.
And if or staff walk in and walk out, and a lot of people didn't like me, but later on they all liked me. And so I was doing a little test to see how many people are washing their hands.
Okay. And what did you find out?
Oh, they were not. Lots of people were not washing their hands.
Oh, okay.
And that happens all the time, right? And it's a pretty common natural phenomena. Okay, so we are supposed to, all our mothers have always said, wash your hands when you come into the house, wash your hands before you're eating your food. We forgot about it. We wash the hands, we go in, we'll turn on the faucet, and about 3 seconds, just a little bit of water, and we're out of there.
Right.
The soap is there. The soap is there in the dispenser or the soap dish. We don't use it. Now it's time to go back to what all our mothers were telling us to do.
Yeah.
They were absolutely right. It was not coronavirus. What they were teaching us was the best hygiene that you could think about. Wash your hands vigorously. One of the things, and I'm going to put my hands up for a second so you might not see my face, but one of the important things that you have to remember is that you've got spaces over here, right? You got all this space. You've got all this area that if you're not washing it carefully, and you've got nails, right? So when I was at Hopkins, one of the things that I had instituted was that in intensive care units, and I was actually monitoring or policing it, that the nurses, whomever was working, the nails were clipped and they had no nail polish because it can carry infection.
Okay.
So the thing is, I'm not saying don't wear nail polish. Please do. It's fine. But make sure you wash your hands, okay?
Right.
And clean them properly, going across, over, making sure your thumbs are clean. You got to wash it for at least 20 seconds. Do that for yourself. Do that for your family, for God's sake. It's important. And then when you finish washing your hands, if you take the same hand, right, and touch the faucet, guess what you've done?
Reinfected yourself?
Absolutely.
Or potentially reinfected.
Potentially, not necessarily, right. Potentially. Yes. So the best practice is to go and get a paper towel, right?
And use the paper towel.
And then wipe and then dry your hands, and then use that paper towel to close the faucet. Keep the paper towel with yourself. Open the door handle. Once you're out, throw it
away. Okay.
Yeah. So that is something very, very important. People have said you got to do it. What is it? You have to sing "Happy Birthday" twice or something like that to yourself. And if you do that, then you're doing good. Now, the other thing that people have to appreciate that just putting hand sanitizer on yourself and just going like this is not going to help. It's just not going to help. You have to put enough hand sanitizers, which is 60% or more alcohol based,
Right.
that your hands are so kind of wet that it takes, if you go like this, it takes 15
Air.
seconds to dry.
Okay. And again,
Not,
I'm guessing you're going to have to get between those fingers and into the edges
yeah,
and things, just like the way you're describing washing, correct?
absolutely,
Okay.
absolutely. Absolutely. The other thing that a lot of people are doing, and it's
Mm-hmm.
not a bad practice. My mother used to do that to me every single day. Okay, and
Mm-hmm.
my kids and my wife make sure that I do it. As soon as I get home, I gotta go change my clothes, put my clothes in laundry, wash my hands, and then I can go out and meet the family.
Mm-hmm. Yep.
Nothing wrong with that.
No, no. Makes
Actually,
sense.
actually, it does make sense. Think about it. It's a good habit to do that.
Absolutely.
Hygiene, cleanliness. There's nothing wrong with it.
I
So that's a practice in our home. And if you as soon as so yesterday I went in, there was something that I just wanted to go and say hi to my wife, and my daughter goes, "Papa," and what happened? Don't touch it. I said, "Oh, I'm sorry. Go and wash your hands, clean yourself, then you come back to the kitchen table." I said,
Oh,
"Yes, ma'am, I'll do that."
okay. So you've taught them well. You've taught them well.
No, actually, I think my wife has taught them.
Okay. Well, we'll give her the credit too then. Um,
Yes.
Now, here's a question that we're getting a lot of from people, because there's so much information that's changing. But the general CDC guidelines are saying that the social distancing means we have to stay 6 feet apart from each other. But
Yes.
we're seeing some research that suggests that the droplets may be able to travel further than that. And then you've talked about the aerosolized element, where the virus may be able to be traveling airborne through rooms and various areas. And of course, we know that they're basically telling the public you don't need to wear a mask. But I think that that's more about the availability of masks for healthcare providers, because it would seem to me that maybe wearing a mask might actually be helpful if we're out and about.
So as you know, things are changing, and we have preliminary data that is suggesting that it
Right.
might change tomorrow. Okay,
Mm-hmm.
so stay tuned. Very important to be educated. So the most important thing is that one understands what's going on. Don't make it your life. Oh, yeah, but before I start giving you that answer, so I got I got a message on my Facebook page
Okay.
that I just got a PhD in coronavirus from WhatsApp University.
Ah, WhatsApp University. Okay.
Yeah. So there's so much of it. Please, folks. First thing
Yeah.
is that if you're not an expert, don't listen to anybody else except an expert. Do
Mm-hmm.
not just go out, because don't go out and listen to people who are saying take a blow dryer and put in your mouth and turn on the heat and kill the virus in your throat. Don't do that. Don't do all those things. So so things change. Watch the scientists, watch the data that's coming out, and you will get enough information. Now, masks, right?
Mm-hmm.
So how effective are masks? I think during the was it the influenza pandemic? Yes, or maybe before that. I gave a lecture at the Academy of Sciences on masks.
Mm-hmm.
It's available online. If somebody does Chotani and masks, they'll find it. It's still on their website. And I like that lecture. It was a good one. One of the things that I talked about that during that time was the effectiveness and efficacy of those masks.
Mm-hmm.
So there's a particular reason that you wear a mask. And if the mask is not worn properly, number one, the virus is so tiny. It's not like a penny sized virus, right? I mean, it's not a big marble ball or anything like that you're going to wear something and it's not dust particles, right? It's way, 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 way smaller than that.
Mm-hmm.
And if you're not wearing the mask properly, guess what's going to happen? It's going to go from the side all over the place. It's not going to do you any good. Now, if you wear a mask and if you touch surfaces and you touch that mask, you've contaminated that mask.
Mm-hmm.
If you take that mask off and put it on a table, you've contaminated that mask, and you're going to take and put it back on you. You've got the disease. So there are ways think about this. I'm talking about just a common surgical mask.
Yes.
Now let's talk about what people are talking about, the N95 mask, right? So N95 masks are also, I mean, they are the masks that will, because of the size of the virus, they are good, and the virus will not go through the layers that you have on the mask into your mouth or your nose. The problem with the N95 mask is that you have to fit it. It is not that you can just take the mask and put it on and you're done. It has to be fitted properly. And you have to fit it properly. And then if you take it off, again, you've contaminated it, right? So the thing is, and then, and what happens with masks is at workplace that you put on the mask and, it's just not easy, right? You're not used to having it. So you pull it down, you pull it up, you contaminate it constantly. Masks are useful. There's no question about it. But I think the best practice right now is to have wash your hands, keep your hygiene proper, social distancing. Stay home if you can. Don't go out. Have fun. Yesterday, what my family did was just incredible. What they did was, so every year we go out and go to Shenandoah or some other park and we do camping, and we've got this huge tent. And so, they had nothing else to do. So they said, what we're going to do is, 2 days ago, actually. So they took the tent out, made the tent, and everybody was in there. The tent is still in our backyard. And now they use it to play because, that's something extra. They go and play board games on it.
So some backyard camping, right?
Backyard camping. And, this is the ideal time, in all honesty. I look at silver linings in crisis. And here is an opportunity for you to connect with your family. Sure. And be with them and learn again, once again, how to talk. Because what we have been doing is we've stopped talking. We use our phones